Don't forget to follow us on X or Twitter at Dr. Dahlia, Facebook, The Dr. Dahlia Show, and on YouTube, click like and subscribe. So for years, we have been told prostate cancer is unlikely to kill you, that you are more likely to die of something else than prostate cancer, and that we should slow down on the screenings, reevaluate the screenings, and not panic about it because doctors are doing too much to patients and the risks are outweighing the benefits. Yet I had patients whose prostate cancer was, a little bit more aggressive, and we caught it early. And here we are with President Biden having an aggressive form of prostate cancer that has metastasized to the bones, and people are still kind of questioning, wait a second, I thought prostate cancer outlives you, or you outlive the prostate cancer, or whatever the phrase is, because if it's not going to kill you, you'll die of something else. But O.J. Simpson died of prostate cancer. I think Bill Bixby, right? He was the one from The Incredible Hulk. Telly Savalas, the one who played Gunther on Friends, James Michael Taylor, I believe his name is. He died of prostate cancer. People are dying of prostate cancer. Now, Ben Stiller had prostate cancer, still alive. Ian McKellen, still alive. But prostate cancer kills. Frank Zappa died of it. Merv Griffin, I think, died of it. And so when you, Dennis Hopper, I believe, lost his battle with prostate cancer recently. And so even though, thank God, Robert De Niro's still alive and Rudy Giuliani's still alive and Ben Stiller, and that people are managing it, maybe we need to have a different narrative as it comes to prostate cancer. As I told you, cancer can be chaotic. You might think you have something slow growing or in remission, and then all of a sudden it shows up somewhere else. See, me, I was very humbled by how severe prostate cancer could be, because when I was an ER doc, somebody came in with severe neck pain. So I x-rayed it, and he had holes in his bone. And I'm like, something's not right. And we put him in C-spine precautions because it looked like his cervical spine was going to crumble. Well, after CT and after we, did a little investigative work, he had prostate cancer that went to his cervical spine. Now, he was very upset that he got this diagnosis, understandable. And he's like, I don't want to be in C-spine precautions. Let me go. I walked in here, I could walk out. And the ER doctor I was working under said, no, you can't do that because you could sever your spinal cord. If you fracture your cervical spine, you could die. Let us ship you to Las Vegas. There's neurosurgeons there because I was working in Lake Havasu. So they could take care of you, but we're going to keep you comfortable, but do not move your neck. We're going to have you in C-spine precautions. We have the brace on, etc. Well, apparently he was upset, and when he got to the hospital, he decided to just rip it off. Well, he drops, severs his cervical spine, and he ends up dying. So I learned early on, you don't screw around with prostate cancer. Prostate cancer could take a healthy appearing person and cause them to die in a heartbeat. Not all prostate cancers. But we're having this conversation now because people are wondering, well, then what's going on with Joe Biden? Didn't he have a full physical? Didn't his doctors look at him and test his prostate? Aren't we still screening? So the screening recommendations are getting more and more conservative, not politically conservative, but more less open and liberal. Not that that's supposed to be equating necessarily to political ideology, but the American Cancer Society reports that about 300,000 new cases of prostate cancer will be diagnosed each year, and about 34,000, maybe 35,000 patients could die. In 2018, the USPSTF released their final recommendation saying that if you're 55 to 69 years old, to make an individual decision about whether to be screened after a conversation with your clinician. If you're over 70, the potential benefits do not outweigh the expected harms, and these men should not be routinely screened for prostate cancer. Now, the American Cancer Society is a little bit more, open to screening. They say age 50. Don't wait till 55. Age 50 for men who are at average risk and who are expected to live at least 10 more years. Age 45, if you're, and this is what I've been asking for years, if you're Black, African American, or if you have a first-degree relative with prostate cancer. Why? Because whatever slow-growing cancer you think somebody has based on Caucasian studies might not be equitable to those of different demographics and different races. So, Black men can have more aggressive colon cancer, can have more aggressive prostate cancer. We do need to understand that screening guidelines need to be more fluid. They want this American Cancer Society wants prostate cancer screening at age 40 for men at even higher risk. They could have a digital rectal exam. They could have a PSA done, prostate-specific antigen. And if after this discussion, a man is unable to decide if testing is right for him, the screening decision can be made by the healthcare provider, who should take into account the man's general health preferences and values. So they also suggest that men who choose to be tested and whose PSA is under 2.5 need to be retested every 2 years and should be done yearly if your PSA level is 2.5. If you're under 1, that's a really good sign. So I did it differently. The reason why we caught prostate cancer was aggressive ones is I would do a baseline screen for those who wanted it in their 40s. And then if it was over 1, I repeated it in a year. And if it jumped, then I sent them to a urologist to monitor that because their PSA might be rising. If the normal level goes up to 4 and they're going from 1 to 2.3 within a year, that's a pretty big jump. So I would refer them to a urologist and let the urologist have the discussion with the patient. But if O.J. Simpson died of prostate cancer, James Michael Tyler died of prostate cancer, Lloyd Austin, Defense Secretary Lloyd Austin is being treated for it. Silver Knights head coach had revealed he had prostate cancer. Men are getting prostate cancer. And the numbers may be rising. And sadly, they might be found at a more aggressive rate because people aren't going to the doctor. They're not getting their yearly rectal exam. They're not getting their yearly exam. And so they're waiting until they have an issue. Or they're using telemedicine who can't check the prostate. You just can't check through a USB port. It doesn't happen. So in light of now President Biden, who, remember, their administration said he was healthy and could run another 4 years, now being leveled by metastatic prostate cancer to the bone, the average person watching all this is saying, well, if the Biden administration is truthful about this being a brand spanking new diagnosis, then maybe all we've learned about the slowness and methodical and lack of need of aggressive testing and screening might need to be reevaluated. So personally, I think he probably had it for a while. Whether they chose to disclose it or not, or whether the doctor didn't test him, I don't know. But obviously that doctor's going to be up on malpractice charges if he didn't test, or, because somebody with metastatic disease to the bone would have had back pain. We would have picked this up on scan. That's for another discussion, and we'll see what happens when, I think it's Dr. O'Connor who's going to be subpoenaed, I believe, by Congress to find out more information about what happened and what care the former president got. But prostate cancer is real. And so when I talk to patients who call online saying, yeah, I think my prostate's big, just give me medication. And when I say, but you need to be evaluated, they're like, no, because what? We don't do anything for prostate cancer anymore. Yes, we do. Why are people thinking that? We don't do anything for prostate cancer anymore. Who's been telling that story, that lie? Well, it's because there were individuals where their prostate cancer was slow growing. They underwent a radical prostatectomy, had then sequela from that. And so we as doctors were urged to rethink being aggressive about prostate cancer if prostate cancer isn't aggressive. But men are living longer. So the idea that the average man isn't going to live past his 70s so you can blow it off, no, you can't blow it off. Aggressive prostate cancer is a cancer. So maybe the USPSTF needs to rethink, or doctors need to have their own conversations with the patients, which the USPSTF recommends. And maybe we do need to be not as nonchalant about prostate cancer. 1-877-DOC.